volunteered in different activities all over the world. It gave me a perspective how people and patients suffer from different things. I was also a patient by myself. That also sort of pushed me to put myself in patient's position. I'm Dr. Karthik Rangana. I'm a transplant nephrologist at Penn Medicine. I've been seeing kidney disease patients over many years. And eventually, as we all age, we do develop certain element of kidney disease. A lot of patients are on dialysis. And unfortunately, patients with kidney disease and dialysis tend to have a lower lifespan. The mortality rate is higher. Transplant is one way of helping them prolong their lifespan and making their quality of life better. My focus of work primarily at Penn is kidney transplant patients. And so what we do is patients who are on dialysis and who have advanced kidney disease, they are be evaluated to see whether they are kidney transplant candidates. And once they are decided to be kidney transplant candidates, they are placed on the wait list and we continue to see them until they get a kidney transplant. We take care of them while they are getting a kidney transplant. We continue to see them post-transplant to make sure they are successfully transplanted and also successfully maintain their transplant for many, many years. Some of the patients have challenging situations. Some of them are denied transplants in other centers, and we take that up so that they can be successfully transplanted. And that can only happen at a center like Penn Medicine because there are multiple disciplines which have expertise in different areas which can make that happen. I've had patients who was waiting for a liver and kidney for many years. They were so happy to come and get transplanted, simultaneous liver and kidney. They were successfully transplanted and they are doing very well.